I'm Ann Conley, and I'm from Ohio, and I am actually going to refer to my notes as I do this because I'm the newest member of the Action Learning Collaborative in Ohio, and I don't want to forget anything really important. So I'm not gonna be like those lovely people where I'm gonna refer to my notes, so pardon that. But we were given some questions to think about, so I'll be referring to those. So as we look around the state of Ohio, there are a number of challenges related to preconception health in general. Ohio has a very conservative social and political environment, and the term preconception health is like waving a red flag in front of conservative folks in Ohio, so that makes it a challenge to talk about this subject there. We have had in Ohio, we have supported abstinence-only messages and programming over the preceding 10 years, so this was a big deal to talk about these things. Ohio has no health education standards or a required health curriculum. Again, this makes it a challenge talking about these subjects. As a home rule state, in Ohio, each of the 613 public school districts, not to mention all the non-publics, all of them can decide what they're going to teach and when they're going to teach it and how to implement any kind of whatever health ed that they want to do. And we have data, we have some up here if you're bored and want to come read our poster, that talks from a variety of sources showing that Ohio youth have a lot of unprotected sex and surprisingly get pregnant. I know you would be shocked. So we had a number of key partners in our efforts. We have a wonderful group in Ohio. The Ohio AAP and the Society of Adolescent Medicine are really, really excited about working in this area, and they have been wonderful collaborators with us. We also have stakeholders including child welfare workers, mental health specialists, education and public health agencies, and each of them were selected. We particularly tapped some of these groups because of their agencies' reach into areas that we don't have quite so much access at the health department. Things that have gone really well, we've seen improvement over 3 areas. We have a CDC Coordinated School Health Grant, and so ODH and the Department of Ed are collaborating more than ever, which is good. We have an extremely dedicated and active AAP, as I said, and there was also a creation of the Governor's Office for Women's Health that became a very strong partner for us. We also surveyed and convened a bunch of adolescent health stakeholders, and again, there's information here about that. And we created an adolescent health literacy framework and a brochure. So these are some of the products for our group. Some things that are challenging, as I mentioned, I'm the newest member on this collaborative. There's been a lot of turnover in Ohio since we have, people have retired, people have had babies. It's been a challenge to keep things going because of that. People have competing priorities at their home jobs that make it hard to get together. There's one more thing I have to look at. And things that we're excited about in the future, we're excited to help fill the gap in resources used by professionals working with adolescents. We're excited about that. And helping local school districts identify and connect with adolescent health experts in their communities. And we look forward to continuing the process of defining priority health issues and development of a strategic plan to promote adolescent health in Ohio.